Hello. Thank you so much. I'm Carrie Sipp. I'm the Director of Nonprofit Partnerships for CHC, Creating Healthier Communities. And today we have incredibly prestigious panel with us, speakers with us, Dr. Jeff Linkenbach, Carla Ritz, and Sharon Hirsch. And I'll go through all that in just a minute. But today we're talking about leveraging the science of the positive to grow your organization and create healthier communities. So why the science of the positive? I'll tell you why the science of the positive, because we humans have brains that are wired for survival. We've got this thing in us called a negativity bias, and it keeps us alive because for 300,000 years, the negativity bias has helped us remember the dangers of poison berries and wild animals and rival tribes. But today, the threats have changed, but our brains have not. We still have the old brains. So the negativity bias, it's very hard to turn off because what kept us safe, the negativity bias that kept us safe is now kind of wearing us out. So perhaps we're being called to evolve, to retrain our brains to create intentional positive focus on what's working and what's possible and what's worth celebrating. Because what we think about, we bring about. So here today, we're going to shift our attention toward resilience and optimism and well-being, to focus on the strengths in our organizations, and to lift up and amplify the positive changes already happening in our communities. For example, the positive childhood experiences that protect us and help prevent adult mental illness. And all these slides are going to come to you, so I'm going to rip through this very quickly because we want to get to Jeff very soon. But I wanted to tell you that we are wanting to help lead this shift. So for practice, one thing as we go through this, and you hear about the science of the positive, be thinking about how you might take the science of the positive into your organization. In addition to helping us now shift our attention toward the positive, we want to thank you for being here for this. As I said, we've got Jeff Linkenbach and Carla Ritz, who's the managing director of the Montana Institute. Jeff is the founding director of the Montana Institute, and Sharon Hirsch, who is president and CEO of the Positive Childhood Alliance North Carolina, which is a nonprofit organization. And we help nonprofit organizations like Sharon's, CHC does. We are a national nonprofit that helps organizations achieve their missions by bringing together communities, nonprofits, and businesses. We work closely with our partners to create scalable, sustainable solutions that drive real change. We touch about 5,000 nonprofits. We work with about 650 corporations. We touch the lives of 17 to 21 million people. And again, all of this is going to come to you so you can look at it slowly. But we helped create the combined federal campaign, which is the campaign that works with the Office of Personnel Management and helps our millions of federal employees donate to nonprofits, and then those 650 businesses helps their employees donate to nonprofit organizations. We work in multi-sector programs, events, convenings. We help organizations with volunteer work, and we help build capacity. We help them with their marketing. We also have some programs where we work closely with community-based organizations. Our Black Birthing Initiative and Vaccine Equity Initiative are among those. We also have policy initiatives. We are really out there wanting to protect Medicaid. We take an active role in advocating for those policies because at CHC, we envision a world where every person and every community has an opportunity to live their healthiest life. So we are trusted by America's most trusted nonprofits. And we hope that you will consider becoming a partner with CHC. The code will take you to the page to fill out an application. And with that, I'm going to now introduce my dear friend, Jeff Linkenbach. Jeff is an innovator in social norms and research and public health research, health leadership. He's the founding director and research scientist at the Montana Institute. He developed nationally award-winning programs that positively transform community norms based on the science of the positive. Jeff has more than 30 years of experience in public health leadership. He's worked with tribes, with federal, state, and local organizations to achieve positive change and transformations about issues that are very dear to us, such as child maltreatment, substance abuse, traffic safety. And he's worked with the White House, the Substance Abuse and Mental Health Administration, the Centers for Disease Control and Prevention, the Canadian Agricultural Safety Association, Harvard University, the American Medical Association, the National Football League, and the Carter Center, one of my favorites. So without further ado, and just a tiny bit behind Jeff, I'm turning this over to you, and we'll make up time at the end. So thank you so much.
Thank you. Thanks, everyone. What an impressive group of folks. 30 years ago, as the drug czar in a community in northern Colorado, I was presenting to a classroom, and the topic was substance abuse prevention. And at that time, the best practice and the assumption was if you let kids know about all the risks and harms and talk about how they and their norms and their peers are all at risk, then somehow that message will come through. But there's this one gentleman, this one boy in the back of the room who just sat there, arms folded across his chest. His body language was shifting the entire time. And then kind of halfway through my litany of risks and fears, he says, "Dude," and the classroom gets quiet. And I need to let you know, 30 years ago, dude was still just a pronoun. It hadn't like expanded into a paragraph like, you know, how young people use it today. But he's like, "Dude, that's not who we are." And then I got quiet because he was right. He was challenging my assumptions about how to bring health into his generation. But I'm coming from the this is your brain on drugs generation. You guys remember the frying pan? Some of y'all will. And these are basically fear tactics, right? This is what we were doing at that time. And our assumption was, we're going to scare the health into you. We're going to show you all the ugly kinds of things that could happen. So these are fear appeals, right? They're persuasive messages to try to scare an audience into adopting some sort of a positive response. But then we started looking at this. We, meaning my team and people across the nation, Marty Seligman in Pennsylvania, the founder of positive psychology, many of us started questioning. And in my own college campus, we found that when we were marketing these fear appeals, for example, around binge drinking rates were going up. And so we'd do more fear, and then they'd go up even more. And we were seeing the same thing happen with traffic safety, with different audiences and populations. We had forgotten first, do no harm. And we were experiencing these iatrogenic effects, meaning caregiver-caused harm. And so we had really good intentions, but we started looking at and evaluating what we were doing. And we had forgotten first, do no harm. There's many negative effects of fear that have shown up in the literature over the past couple decades. Here's some key findings that we see. When we start promoting fear, we start to label and stigmatize people. They start to feel isolated and targeted. And so, in fact, in our organization, we never talk about a target population because the people we work with say nothing good ever happens to a target. And many of these folks, I mean, that sounds funny, but many of these folks are coming from some historical cultural trauma that's legit. So, but it starts to expand social gaps instead of bringing people together. It's backfires. We start actually promoting the poor health. The more that what we market actually is what grew, and it starts to distort views and narratives. And in particular, what we're focusing on today, in terms of growing positive cultures, it exaggerates negative norms. It creates a condition of what I've written about and call cultural cataracts, where we basically have these dark, dim, skewed views of who we are. Or we may think about another audience, them, kids these days, right? And then you start filling in the gaps. They're on their phones too much, right? And here we go, right? But we started to use the science and really start diving into the research. And because of that young man in northern Colorado confronting me, I started to completely shift how I was thinking, researching, and asking questions. And so that's what I wanted you to hear today. The trajectory is the risks are there, and we don't want to ignore those. But how do we start to grow the positive? And what happens if we focus on what we call the green arrow? in particular, when we're talking about cultural transformation, at the heart of that, one of the things that we focus on, one of the areas is growing positive norms. And so how do we navigate that? We basically have a 4-step process, but we basically use science, surveys in particular, it could be observational data as well, to uncover the positive, a number of positive things, but especially positive norms. Then we measure gaps, because what happens is we typically misperceive norms. I'm going to show you several examples. But then we start to place our attention and our energy on growing accurate perceptions, and then we measure changes in health and safety cultures, communities. Bottom line is this, and the science has been bearing this out. If we want health, we need to focus on and promote health. I'm just going to say it again, because this is the through line. At therapeutic levels, working with individual clients, and moving out into organizational cultures. We've done national level work. If we want health, we must promote health. And so why is that? The positive and negative are always living side by side. All right? What we might define as positive, negative. So we're not coming from this Pollyannish or toxic positivity angle of ignoring the harms, right? But here's what's critical. Growing the positive doesn't occur just by simply reducing the negative. We don't get to flourishing and optimal performance by just focusing on reducing the things that are getting in the way. Prevention is key. Focusing on the risks is key, but we have to do what I call reversify. If a word doesn't fit, you make one up. So that's what you got here. We need to reversify our focus. Instead of just putting all the attention into the negative and the harms, we need to focus on growing that green arrow. I'm going to get into the weeds here a little bit. The data just are. They're both of these things, however you might define it. They're high risk, they're low risk, they're good, they're bad, but they just are. And they always have this red arrow, green arrow. Here's some data from a statewide alcohol survey with one of the groups that we work with in terms of teen substance abuse. These are the same data, just looked at in a different way. Typically, we zoom over to that red side and go, whoa, did you know that we've got 22% of 11th graders engaging? We need to let everyone know that, right? That was what I was doing with, dude, that's not who we are. But if we come back, what happens if we focus on the 77%? What if we grew the green arrow as a way to shrink the red arrow? This is Public Health 101. It's about preventing risk at the same time of promoting protections. In our work with the science of the positive, we look at both hope and concern as a way of doing this. And so we focus on norms with culture. Oh, geez, I'm dating myself here, right? Who's a norm? What's a norm? But we talk about social norms. Here's a pretty typical definition: the perceived standards of what's okay, not okay, in terms of attitudes and behaviors, right? Statistically, when we start working with different cultures and organizations, we're going to quantify norms as being above 50%. And we're going to find that there are gaps, right, between the actual and the perceived norms. And norms theories show this. We tend to do or believe what we think most people are doing. What we perceive to be the herd is what we gravitate to, but we typically misperceive this. And the way that we misperceive is in this way. We typically, survey after survey, issue after issue, overestimate the risks and underestimate the goodness, the positives, the protections. So our big aha, and the data bear this out, is that misperceptions of norms start to become risk factors and accurate perceptions of norms become protections. I'll give you a few examples. Staying close to the one I started with, teen drinking. Here's an example of how it shows up. The true norm in this particular group of 10 schools and high schools, 89% of the high school students had not used any alcohol in the previous 30 days. However, over half, 54%, thought most were. So what's the big deal? The big deal is the teens who accurately perceived, in this case, were 6.9 times less likely to use alcohol. The accurate perception that most don't drink is protective. Same thing with vaping. 76% of the high school students in the previous month had not used any vaping. However, 82% thought most had. Think of the conversation going on in this culture. What's the big deal? Those that misperceive are at higher risk. What about adults drinking and driving? We've done a lot of work around traffic safety, for example. Actual norm and statewide sample of a group we worked with, 86% had reported they had not driven a motor vehicle within 2 hours after drinking alcohol in the previous 2 months. However, 89% thought most were drinking and driving across the state. What's the big deal? The misperception is a risk factor. So one of the themes here is we need to go from fears to peers, and not just for kids, but for all of us. That's what we do with the science of the positive framework. And what we're doing is we're focusing on and studying how positive factors impact cultures and experience. We have a framework for how we do this. I'm not going to go through all this right now, but we have that on our website. We'll be providing other trainings with y'all and get to the granular level. But what I want you to see is we start with a focus on the positive in the center. Then there are these different steps and principles, but we always go spirit, science, action, return. Spirit, science, action, return. And this is critical in terms of how we start. We do this because our core assumption is that the positive exists. It's real and it's worth growing. And it's in all of us, our relationships, our communities, our organizations, our cultures. And the solutions are in the community. They're already there. We just have to have ways to extract that. And this is how we do that. We would come in this way. We ask these kind of guiding questions. What's going to be the spirit or tone of the work? Am I presenting fear or am I presenting something with hope? Then that shifts how we approach the science, the data collect, how we analyze the data, and we'll direct our actions, hopefully based on best practices and evidence, to get the kinds of returns that we seek. But we start with spirit first. So how do we grow the positive community norms? I mentioned it earlier. We're going to uncover the positive. We're going to measure these gaps. We're going to focus on the accurate norms, the accurate perceptions, and grow those to increase health. So we mind the gap. Why? Because perception is everything. What we perceive to be real becomes real for us in terms of where we put our energy. And this is so powerful. The perceptions pull the narratives in each one of our organizations and communities and cultures and with our clients or patients, whomever you're working with. The perceptions pull the narratives. So this is really critical. So when we promote accurate norms, we're bridging these gaps with the misperceptions. These are examples of what it looks like. This is a billboard in Alexandria, Minnesota, for example. We're promoting that positive norm. We're not talking about the fear of the negative norm. This is in Seattle, in King County, in terms of marijuana use in young adults. And this particular program has seen significant reductions in marijuana use and motor vehicle use. In Missouri Children's Trust Fund, Carla's done a lot of work and taken lead with this project, normalizing the fact that the majority of parents are having important conversations with their children about personal boundaries. This is a way to help prevent sexual abuse. Mental health, Oakland University in Michigan. Most students at the college are comfortable talking with their mental health with a friend. This counteracts the stigma narratives that we often hear. The stigma narratives are often based on the misperception. In Spokane, 98% would support children they know are impacted by domestic violence. So we need to shift the focus from what's wrong with us to what's strong with us, because it's there. And it's not just for kids. We're talking about all of us as adults. When we do this, we can see increases of interventions to stop adults stopping each other from drinking and driving. We see increases in seatbelt use. In the UK, there's data demonstrating that people are paying taxes on time when they accurately perceive that most other Londoners are doing the same. Recycling programs have seen major uptick by focusing on the positive norms of what most people are doing. Sunscreen use goes up in Sweden and Australia when most people realize most others are using protection. Worksite safety and prevention, PPE use, goes up when workers realize other workers value and are using PPE. We see voting behavior increase when most people realize in their community that others are doing the same. And we see upstander behavior and interventions when most people understand that they want to support and be supported for challenging issues like mental health. We see increases in such behavior. We can uncover the positive community norms as the focus, see and celebrate the untold goodness. It reverses the dude, this is who we are, because we start talking about who we really are in our beautiful communities. And the bottom line is when we change our perceptions, we change who we are. So key theme is there's really good science behind celebrating the positive. I'd love to see some of you join us. We run an annual summer institute. And with that, I'm kicking it over to Carla, or back to you, Carrie. Thanks.
Thank you so much, Jeff. And want to remind folks we have some upcoming webinars on helping our partners with engaging their donors. And we also have one on neuronurturing coming up on May the 22nd. But we'll do more about that as we go, because the CHC University whole idea is to help our nonprofit partners grow their revenue and become more financially secure. So what do we see in our organizations that's positive, that we can help our organization, CHC itself, and our partners become more equitable and even better places to work by identifying and lifting up the positive. And then as we do our work and the nonprofits do their work in the communities, that this is going to help support creating healthier communities. So all of these events are free and we offer them to you. If you register, you'll get the slides, you'll get the video. And so now I'm going to introduce Carla Ritz, who is a longtime advocate in early childhood. She's got 17 years as a nonprofit leader in early childhood advocacy. She has worked in a community that I know a little bit about because it's a PACES Connection resilient community, First Five, Lake County, California. Yay! She's focused on reducing adverse positive experiences, which beats hard in my heart and runs through my veins, to reduce adverse childhood experiences and grow the positive experiences. Her bachelor's degree is from University of Arizona, and she is currently pursuing a master's in education from George Washington. What she does for the Montana Institute is integrate the science of the positive into organizational culture, and she's going to give us a little bit about how she takes this work out into communities such as your community, working with organizations such as your organizations. Thank you, Carla, for being with us.
Oh, thank you, Carrie. It is so wonderful to join this group today. Thanks for having me. I am going to just pivot into another application of the science of the positive that's based on positive experiences and the health outcomes that we see from that. So shift your thinking now from positive norms, which is one application of the science of the positive, to positive experiences. And I would just ask you to think about this question. What is one safe, stable, and nurturing relationship or environment that you remember from your childhood? What made it feel that way? Or you can also choose this question. How are you trying to provide a safe, stable, and nurturing relationship or environment for a child or children in your life now? What does that look like? What do these things look like? Safe, stable, nurturing relationships and environments. I would love to see in the chat anything that comes to mind for you. And time with my grandmother. Thank you, Sharon. I hear a lot about grandmas and grandpas, lots about aunts and uncles, lots about neighbors. I hear things about my friend's mom made me a tuna melt at her house once, and I'd never had something that exotic in my life, and it was amazing. And then she saw that I loved it, and she made me another one. They don't have to be big things, right, that make us feel safe, stable, or nurtured. They can be very small things. Quality time. I see these things coming in. Music programs. Yes. So positive experiences, think about these things as we go through this, because the science didn't start there, and it rarely does, right? The science started with ACEs, or adverse childhood experiences, and we learned a lot about the things that cause toxic stress to build up in the systems of children, and then some of the health outcomes that can be more likely for folks who have more adversity in their childhood. And you all probably know the science very well. If you don't, this is a great resource, numberstory.org, if you're wanting to learn more about the science behind adversity. And the more we learned, the more we understood, not just about the adversity, but the things that caused it. So that was some red arrow research, and it was really important, right? And those of us who are in this field, studying these things, and more importantly, the things that happen in real time with real families and ourselves, we're having to ask ourselves, were we getting the returns we wanted from focusing there on reducing ACEs? It needed to be done, but were we getting the green arrow at the same time? And we weren't. And so we started asking new questions. What if the positive has lasting impact like trauma does? So when we have a different spirit, we ask different questions in our science, as Jeff alluded to earlier. So what if there's something besides ACEs? This is one way that the science of the positive has been applied. So now we have some different terminology around this. We have positive childhood experiences, benevolent childhood experiences, counter ACEs, PACEs. You might have heard it a lot of different ways. It's being measured in different ways. There's different scales, there's different surveys, there's different ways that people are gathering proxy measures from existing data sets, both in the US and internationally. And I'm so happy to say this research is just exploding. It is unbelievable. I could do an hour-and-a-half webinar for you on just what's come out in the last year and a half. So we have really latched onto the positive when it comes to health outcomes from positive experiences. This is a baseline publication that came out in 2017. You can find it on our website if you want to see sort of where it originated. But the first publication was in JAMA Pediatrics, and it combined positive childhood experiences with adult mental and relational health. That was what we were looking at. And I shouldn't say we because I was not involved, but Dr. Christina Bethel, Jennifer Jones, Dr. Jeff Linkenbach, Dr. Robert Segi, and others published this in JAMA Pediatrics. And these are the sorts of positives, the green arrow items that they were wondering about. Did your family stand by you during difficult times? Did you enjoy participating in community traditions? Did you have at least 2 adults in your life, not your parents, who took a genuine interest in you? Felt supported by friends, a sense of belonging in high school, able to talk to your family about feelings safe and protected by adult in your home? Did you feel that way? These are the sorts of things. And what they came up with as they did that research and compared those PCEs that adults reported with their current levels of depression or poor mental health in adulthood, they found this beautiful correlation that looked a lot like ACEs data, this dose-response relationship, but flipped on its head. So that the more positive childhood experiences you had, regardless of how many ACEs you had, the less likely you were to have depression or poor mental health as an adult. So this is what it means to apply the science of the positive in a different way. And so we found out that there are these beautiful odds ratios that live right alongside that red arrow. 72% lower odds of having depression or poor mental health if you had 6 to 7 of those positive childhood experiences as opposed to 0 to 2. That's a different set of data, right? So we've kept going. Many researchers have really poured into this, trying to understand more about the positive and how it grows. And these are some of the things that have come in just since 2019. The more PCEs, the more flourishing. The lower odds of perpetrating bullying or being bullied with the more PCEs that you have. Lower odds of smoking or illicit drug use. Lower odds of high risk alcohol use behaviors in adulthood. Better midlife cardiovascular health. That one came out of left field. I didn't see that one coming. Healthier weight in childhood. Fewer reports of chronic pain in childhood. Decreased recidivism after childhood criminal offense. This is all with the more positive, growing the green arrow. Less PTSD symptoms in adulthood. and lower odds of depression and poor mental health, both in adolescence and in adulthood. So that's the science. That's how one more way that the science of the positive is playing out. And so what do we do with it? When we have new science, we have to act on it, right? And so now that we have some science emerging that came from a different spirit, one focused on the green arrow of hope, uncovering and understanding the very powerful positive experiences in childhood, what sorts of actions might emerge? When all we had was ACEs science, we looked at that science with a spirit that focused on the red arrow of concern and risk and harm. And our actions really focused on raising awareness of harm and making everyone trauma informed. And that was important work. And now that we have science about positive childhood experiences, we get the opportunity for new actions. What new actions might be part of the work that we all do based on this science? And I ask people this all over the country. Now that you know this, and I usually get a whole lot more time to share about it than just a couple of minutes. But now that you know this, how does it connect to who you are, to your life, to your work? And then what's one action you might take? Because when we know more, we can do more. We know better, we can do better. And we're going to hear from Sharon Hirsch in just a moment about how she and her team are taking the spirit and science behind health outcomes from positive experiences and applying them in North Carolina. And as you listen to her story in just a minute, I would really love for you to consider these questions for yourself and your organization, because you're going to get this beautiful practical example. So just rounding things out and sort of shifting into culture, because we've talked a lot about childhood, we've talked about health. What about our organizations themselves? How does this apply there? And I would just say that this quote is really at the heart of this idea. Getting what is good in life entails a lot more than just eliminating what is bad. And Jeff referenced that as well. And with that in mind, there's just really no big black line at our lives at age 18. So when we talk about positive childhood experiences, we're talking about what happens between birth and 18, but our lives are not actually separated between childhood and adulthood. That's just what we use for research. But our life is one long continuum. And so what if you, and what if the people you serve, what if the people in your team or your organization had high adversity scores and low positive childhood experience scores growing up? Now what? The first research on positive adult experiences using a questionnaire that included PCEs and BCEs, or benevolent childhood experiences, adapted for adulthood, was published in just a couple of years ago now in Frontiers in Public Health by Allie Crandall and her team at BYU. And you can see from this list that they are operating under the assumption that what was good for us as kids is still good for us as adults, and that our needs for safe, stable, nurturing relationships and environments did not stop when we turned 18. And what Allie and her team uncovered is that positive adult experiences, is what they're calling them, are turning points for better adult mental health after childhood adversity. And that's encouraging. So which matter most? What they're finding is the same thing with ACEs. What matters most is the accumulation of the positive. The more, the better. And be encouraged. This research is filled with hope, and there are more studies coming out all the time. So stay tuned on that. Hopefully we'll get to share more with you in the future about that. But the science of the positive framework is now being used to apply the emerging science of health outcomes from positive experiences in adulthood to help organizations create cultures that are safe, stable, and nurturing, where burnout in your organization is not the norm, where uncovering and growing what is good isn't something that these agencies and nonprofits are just doing in the world, but they're also doing within their own four walls. So I'm going to pass it over to Sharon, who's going to explain how this has played out in a real life nonprofit organization in North Carolina. I believe Carrie will introduce her first.
Thank you so much, Carla Ritz. And yes, we are never too old to change our brains, and positive childhood and adult experiences absolutely change our brains. And we'll be talking a lot more about that at the Neuro Nurturing webinar that is coming up May the 22nd. Sharon Hirsch knows a whole lot about that because she is the president and CEO of the Positive Childhood Alliance North Carolina. Sharon leads a team to support North Carolina families and children through policy, programs, and practices. She's got 30 years experience in nonprofit, government, and agency management, public relations, advocacy, and child well-being. And at Positive Childhood Alliance North Carolina, which I love, it is one of the 47 chapters of the Prevent Child Abuse America vast network of organizations helping prevent child abuse and neglect. But she flipped the script, which we love that. She's increased her staff capacity. She's gotten more than $1 million in new investments. She was named one of the top 25 women in business in the Triangle, the North Carolina Research Triangle. And last summer, I got to watch as she received the Montana Institute's Normie Award for organizational transformation on behalf of Prevent Child Abuse North Carolina, which was a holy moment, I must say. So without further ado, thank you, Sharon, for being with us today.
Thank you, Carrie, for having me. I'm really excited and really humbled to be a part of a panel with Jeff and Carla too, because what I'll be talking about is really what we've learned from the Montana Institute and how we've put it into practice in North Carolina, moving from talking about what we don't want to see to what we want for all kids and families. I like to start all my conversations with this. It's my favorite quote. It's from Peter Block from his book, Community, the Structure of Belonging, because I think it really exemplifies a lot of what we're talking about when we talk about the science of the positive. The context that restores community is one of possibility, generosity, and gifts, rather than one of problem-solving, fear, and retribution. And when you think about what we hear in our society these days, we want to hear more about possibility, generosity, and gifts, because we're talking too much about being afraid of things and solving big problems when we know that our solutions are right here in the community already. So our team went to the Montana Institute 2 years ago, and at the same time, we were doing a lot of thinking about rebranding. We've been around now for 46 years as Prevent Child Abuse North Carolina, and we're really struggling with it. We struggled with it for a long time. There was a lot of confusion about our organization's mission, and the activities that we focused on were very much focused on strengthening families and communities so that maltreatment never happens in the first place. But we often got confused for an organization that works with victims of child maltreatment. Our staff would often hear, "Oh, your job must be so hard. You have to deal with abuse every day." But the reality is we very rarely talk about abuse. Our work centers on building support so that abuse and neglect never happen. And so this rebrand reflects our proud history, the evolution of our approach to promoting protective factors, and our understanding of the science of the positive and the power of positive childhood experiences. And we believe that our new brand more accurately represents who we are and what we do. So we've listened, learned, and evolved our approach over the last 45 years. We wanted a new brand that better reflected the positive, forward-looking, and inclusive work that we do. We really heard a lot from our partners and the organization, and those are really the organizations that we're supporting at the local level, that in some cases they weren't sure about what we did, and many assumed we provided direct services or intervention and treatment. And we actually provide support to those agencies. We're an intermediary. So it was really important for us to clarify our mission in our rebrand. We also found that supporters often couldn't see themselves in our work. Families couldn't see themselves in our work. Preventing child abuse was about other families. It was about other communities. And corporate supporters often didn't want to be aligned with child abuse. We wanted to create a clearer brand that represents our mission and didn't confuse us with CPS. We'd also internally really embraced the science of the positive and really wanted to focus on what we want to see rather than what we're trying to stop. We found that when we said prevent child abuse, people went to child abuse first. And then the other piece was that they don't understand what prevention is. It's a really difficult concept in our culture to understand, in part because it's hard to measure what doesn't happen. So how does Positive Childhood Alliance represent our work? The first part is the happy in our work. We work to make sure all North Carolina children can have joyful, supported childhoods, and that families have the right support and resources to create those childhoods. We know that we're not talking just about kids, we're talking about their families and the communities that support them. The Alliance represents our partnership, which is how we make change happen. We always say prevention happens in partnership, that no one agency, no one organization can do this alone. So we bring together an alliance of organizations from all across North Carolina in different sectors to talk about this. And of course, North Carolina is where we live, work, and advocate, and it's the place that we call home. The next piece of our change was really also driven by what was happening at Prevent Child Abuse America. They created a new theory of change in late 2023, and it represents a comprehensive, evidence-based, and bold prevention framework for the entire country that not only is guiding the work of Prevent Child Abuse America and our chapter network, but also for partners in the field and for policymakers to make sure that we're ensuring equitable and positive childhoods for all of our children. They developed this theory of change for all of us. And this graphic version was developed over an adaptive strategy process that took more than a year. It engaged all of us in the chapters, the Healthy Families America Home Visiting Network, and more than 1,500 families across the country. It leads with evidence and aspirations for kids and families, using language that reflects what families want for their kids. We've talked a little bit this morning about safe, stable, nurturing relationships and environments, which is the framework that the Essentials for Childhood uses at the CDC. And this is saying the same thing. It's just using language that families would use. But it's rare that you would hear a parent say, I'm aspiring for safe, stable, nurturing relationships and environments for my kids. But when we say all children and families are living a purposeful and happy life with hope for the future, that's more like the language that families would use. And so that's the North Star. One of the most important things about this theory of change to me as we were developing it is that the words child abuse and neglect are not in it, even though that's the mission, is to prevent abuse and neglect from happening. And it's because the change we want is for children to grow up thriving with positive experiences. So throughout the theory of change, that's what it talks about, is positive experiences. It's also grounded in what families need to thrive, while recognizing that systems have leverage points at different levels to be aligned and designed to support families. Often systems, as everybody on this call knows and experiences, can make it really challenging for families to get the support that they need. It also recognizes that the biggest lever for change is in changing the conversation and the narrative around family support. That if we can shift mindsets and set formal goals focused on what we want to see for families, that will eventually influence the policies, the programs, and the practices across the ecosystem. It's also based on engagement with different perspectives, because we know that child maltreatment prevention is not the job of one agency or one sector. It requires law enforcement. It requires faith communities. It requires neighborhoods. It requires public systems. We're talking with libraries and all kinds of folks that interact and engage with families, YMCAs. And then finally, it's centered in equity, recognizing that when we focus on families who've been left behind or not included in systems, we can do better for all families. It's also been aligned with or designed with a plug and play version. So I'm going to share with you what we've done to modify this and make it specific to North Carolina. So this is how we're adapting that national theory of change to North Carolina. We've adapted the same North Star. We've adopted the same pieces of the comprehensive prevention ecosystem, but our strategies are going to be a little bit different in North Carolina. We're focused on transforming the narrative around family support. We know that's foundational and the first thing that we need to do to be able to make all the other things possible. We're enhancing capacity of communities and professionals. We're supporting alliances and networks of professionals. We're advocating for programs, policies, and systems. And all of that is about growing and sustaining financial capacity, both at our organizational level, at the level of the agencies that we support, and then the system as a whole. So this is the way that we are talking about this work in our state. Now I want to reiterate a couple of things that Jeff and Carla talked about. We know that the science of the positive isn't a program or a curriculum. It's a framework. And we believe that all the work that we do with this framework is community work. And that's also why I start with that context that restores community quote. The solutions exist within communities, however you define community. For us, it's the statewide community, the network of partners and advocates at the local level, from the mountains to the coast. And it's our partners across the state. For them, community might be a representative group within their town or their county. This framework is set up in a way that it honors the facts that solutions are already there in the community, and that the most rewarding and impactful thing that we can do at Positive Childhood Alliance is to be part of uncovering them and helping them grow at the local level. We're going to use this framework in a way where we don't go into communities and tell them what the answers are and tell them what's wrong or tell them how to fix themselves. We'd never go into work without being invited, and because we know prevention happens in partnership. So we'll do that in a way where we're looking for the positive and talk about how it exists alongside concerns that bring us together often for the reasons why we convene. We're doing a couple of things as an agency to really highlight this. One strategy we've started this year is that we're highlighting our partners in our blog to talk about what they're doing to build child and family well-being in the community. At our statewide summit last month that I'll talk about in just a minute, we rebranded our entire award ceremony to be the Positive Childhood Ally Awards. We stole a little bit from the Montana Institute again because they called their awards the normies. We called ours the allies. And that was a way that we are highlighting solutions that are already taking root in the field, helping people see that they're already doing this work. They just need to promote it a little bit more. Jeff tells us all the time that if we want health, we have to promote health. But too often we see prevention messages that show the exact opposite of what we're trying to prevent. And in our field, we'd often see campaigns for child abuse prevention that would include things like a billboard with a photo of a sad and scared child who looked as though they had been abused or neglected. And we realized that that wasn't working and that we're sending a very big mixed message when we do that. If we want to see families and children growing positive experiences with hope for the future, we have to show children having positive experiences with hope for the future. Part of the good that we're uncovering is that positive experiences happen regularly within communities. And if we recognize that it exists, then we have to start pointing to it instead of giving the problem or the concern all the attention or all the airtime, because that's what we've typically done in our sector. And that's why we're focusing on changing the narrative to focus on creating hope and positive experiences rather than focusing on preventing harm. This next slide is an example of how we do that. You all were asked some questions by Carla that were really similar. We had a fundraiser last spring, and we asked everyone who was there with this graphic artist to tell us about one of their formative positive childhood or adult experiences. And the result is this gorgeous artwork showcasing how easy it is to uplift what's good and positive and hopeful in communities and families, from playing outdoors to their faith traditions, playing sports or in the woods or at the pool with friends and family, reading with parents or baking cookies with grandparents. Positive experiences are already there, and we can grow more of them when we focus on what we want to see rather than what we're trying to stop. And doesn't this inspire more of what's possible than talking about, oh, how awful abuse and neglect is? We now use this graphic in social media and in presentations, and we even use it as a backdrop for selfies at our summit a couple weeks ago. So I'm going to talk about our summit really quickly. I'm going to run through this really quickly. We had our summit with 400 of our allies all across the state to start sharing more directly about the science of the positive, the HOPE framework from Tufts, which HOPE stands for Healthy Outcomes from Positive Experiences. And we modeled the program after what we learned at the Montana Institute, everything from starting with spirit and great walk-on music for all of our speakers to keynotes that focused on science and data, and then creating opportunities for planning and giving folks time for reflection and renewal. And it was really amazing how palpable the energy was at this meeting. It's the first time we were really in person to share our rebranding, and it really popped. There were lots of great ways to market this, and we've sent folks back with lots of messages that they can take in their community about becoming a positive childhood ally. We also had smiles, smiles, smiles everywhere. It was pretty amazing to see the engagement. We had a ball pit, as you can see, that we used to encourage folks to take a seat and make a new friend. There were questions on all those balls. It was in March, and we are North Carolina, so it was during March Madness. We took advantage of that during the NCAA tournament, and it was really extraordinary to see folks that hadn't seen each other in a really long time from all across the state getting to make new friends and new connections. It was a really wonderful experience. The other thing we did that we copied from the Montana Institute was that we brought our mutual friend John Noltner to North Carolina. He's a photographer, and he brought his photography studio. We had 99 of the 400 people who were there had their photos taken, and they shared their answers to this question. What can we do now to ensure a successful future for our children? And these are just 4 of the beautiful examples of the answers to those questions. We now own these photos. John also put together a really beautiful video compilation of all of these. We're going to be using the photos and the video in our future Norms campaign work to be able to share what North Carolinians said that they felt like we needed to do to make sure that kids were growing up happy, healthy, safe with hope for the future. I just love these photos. We also incorporate this message everywhere we go. Every child in North Carolina deserves a positive, nurturing childhood. We know too many families and communities don't have what they need to help children reach their full potential, recognizing that that positive and negative is always with us, but we want to grow positive where we can, and that when families have access to the support and services they need when they need them, their emotional and physical well-being improves. And that, of course, lowers the risk of abuse or neglect. And we know it's good for kids, it's good for businesses to have thriving, productive workers who aren't overloaded with financial stress. It's good medicine because childhood experiences, whether they're adverse or positive, impact health over the lifespan, and it's a fiscally responsible thing to do. So as we end most of our presentations, we talk about how all of these things together make it possible for anyone to be a positive childhood ally. So that's how we are using this work in North Carolina, and I'm excited to spend some time talking with all of you about your reactions to all of this.
I'll say, Sharon, I wish that we had more time to spend about this. We are committed to ending this call at 1 o'clock, so we will be sending out an evaluation. If anybody wants to put into the chat a comment about how you might be using this going forward, I love that Adrian Ralston said, "This work has drastically changed my personal and professional life. I'm so thankful to see it be successful and thriving. Thank you for all you are doing." And we would love to know how you might leverage the science of the positive. But we at CHC are so grateful to Jeff and to Sharon and to Carla for coming and sharing this valuable information with us and with 75 of our friends, some nonprofit partners, some we hope will become nonprofit partners. And we want to remind you that we do have a couple of webinars coming up, May the 15th, on maximizing impact, engaging employees, and elevating your nonprofit and workplace giving campaigns. And then on May the 22nd, we'll have, they mentioned Dr. Christina Bethel. She'll be among our panelists and speakers for that webinar on May the 22nd on neuronurturing, advancing powerful strategies for the decade of the child and Black birthing initiatives. Those are 2 public health initiatives in which we are involved. So we hope you'll look at the registration links, and we'll have those registration links in the email that we'll be sending to you. And then finally, again, thank you so much. We've put the contact information, Jeff and Carla did. Sharon, if you want to put your contact information in the chat. It was on the last slide, but that will all be coming to you in an email, probably tomorrow. It may be Monday, but it's 1 o'clock. We're going to end, and we're going to say thank you again so much. I'll end with Jill Stam or Lucy Corbett saying this positive approach is so valuable. Thank you for sharing what you have done. So we thank you so much. What we think about, we bring about. Jeff, Carla, Sharon, Tyler, thank you so much. Y'all have a great day. Take care.